Trigger finger is a very common diagnosis in the hand. It actually is where your finger can bend down and get stuck. It's ultimately a size mismatch with the tendon going through the little ligaments in the hand called pulleys. They're also tunnels. So sometimes your tendons get swollen and get stuck in these little tunnels, and it can happen to all 10 fingers. Most people at the beginning will complain of pain into the palm, in this area in the palm. And then over time, it's actually where you get clicking of the tendon that's getting stuck, and actually the finger may get stuck ultimately. Some of the treatment options that we offer are steroid injections, nighttime splinting, and there's special trigger finger splints that you can buy online. And finally, we may need to explore surgery, where all we do is a small 10-minute procedure where we snip the little ligament or pulley and allow the tendon to glide freely. Diagnoses that are often associated with trigger finger, it could be overuse, but diabetes is also a contributor to trigger finger.
Dr. Cisco, would you say that once you develop trigger finger in one finger, you're more likely to get it in other fingers? Is that possible?
You can get it in other fingers. Sometimes the most common trigger finger is actually the ring finger. That triggers more commonly. However, all fingers can trigger because we all have the tendons and pulleys at each finger.
Does trigger finger tend to run in families? Because my mom actually had a trigger finger. I wonder if I may get one in the future.
Well, there's not a large genetic component, but it is associated with anatomy. I do find that those patients that have slimmer fingers, or if their tendon is just one that bends at a more 90-degree angle as it goes under that pulley, they're more prone to develop trigger fingers. Also, those patients that have what we call tendinopathies. So if you've had tennis elbow or wrist tendonitis, you may be more prone to develop trigger finger.